Right. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and a very good morning to Malaysian webinar viewers, and a very good evening to US webinar viewers. Hello, everybody.
Hello.
Welcome to the webinar on navigating mental health during the COVID-19 pandemic, presented to you by the Association of Muslima in Nurture and Advocacy, AMNA, and Michigan State University, MSU. Today, we'll be discussing about the COVID-19 pandemic, Malaysian chapter, and how to navigate mental health during these bad times. The coronavirus pandemic has unleashed chaos in the world. Malaysia had its first COVID-19 on the 21st of January 2020. Since then, the Malaysian government imposed Movement Control Order, or MCO, on its citizens, which was first established on the 18th of March 2020. Ever since, we have seen the fourth phase of the MCO, or the Movement Control Order. And now there is a bit of leniency given to the businesses to open with a strict standard operating procedure, or SOP. In total, Malaysia has seen MCO over a period of nearly 2 months. 2 months of stay at home surely has an impact on one's mental health. Surely a lot of people are affected by the stress of the pandemic itself, and it's reciprocating the economic stress on individuals and companies as well. Today, this was on yesterday's data. On the 15th of May, Malaysia has seemed to have been able to flatten the curve of the new cases. In total, as in yesterday, Malaysia has had approximately around 6,855 confirmed cases, with unfortunately a number of 112 deaths and 5,439 recovered from the COVID-19. This was achieved by an early strict movement control order, or MCO, in 4 phases, and probably more to come. A lot of testing by the government National Health Agency and a great healthcare service. We're lucky today that we are joined by 2 esteemed panelists in our discussion on today's title. Let us all give a hand for our panelists today, Dr. Farha Abbasi from Michigan State University.
Thank you.
And Associate Professor Dr. Siti Aishah Hassan from AMNA. Without further ado, I would like to introduce to the floor our first speaker of the day, Dr. Farha Abbasi. I will introduce her to you, the viewers. Dr. Abbasi is an assistant professor in the Department of Psychiatry at Michigan State University and staff psychiatrist at the university's Student Health Center. She emigrated from Pakistan and settled in the USA in the year of 2000 with her husband and her 3 daughters. In January of 2009, Dr. Abbasi was awarded the American Psychiatric Association Samsha Minority Fellowship. She used the grant money to create awareness about cultural competency, to redefine it as not as just tolerance for others, but rather acceptance. Her areas of interest are cultural psychiatry and teaching medical students how to provide culturally appropriate care for the Muslim patients. She worked directly with the Muslim American community to encourage integration rather than isolation from the mainstream society. Dr. Abbasi recently received the Pioneer Award from Michigan All Pakistan Physicians of North America. In addition to her efforts to build bridges between cultures, Dr. Abbasi's work as a psychiatrist has led her to publicly address the barriers that stigmatize and silence mental health issues with the Islamic community. She has established the Muslim Mental Health Conference and is a managing editor for the Journal of Muslim Mental Health being hosted at Michigan State University. She worked relentlessly and tirelessly towards one goal, which is learning to coexist and go beyond our differences to reach one common point of peace and prosperity. Thank you. The floor is yours.
Thank you so much. First of all, happy Ramadan, and inshallah, soon we will be celebrating Eid al-Fitr. And I was reading, first of all, another heartfelt congrats to Malaysian population, government, providers to do an amazing job. You have a lot of people are looking at your model, and the good news of that the curve has flattened, which means less newer cases coming in and more recovering, which is a really positive good news that we are all hoping to get. So alhamdulillah, starting on that positive note. But as a mental health provider, my concern is that if you were exposed or not exposed to COVID-19, if you are ever going to get it or never going to get it, but still this pandemic and this social isolation and all the challenges that it brought is going to affect each and everyone's mental health in some aspect. Think of it as a burning fire. So mental illnesses were already on a rise. We were already facing a big crisis of growing numbers and shrinking resources when it came to mental health illnesses. But so think of it that some people were already burning in this fire of depression, anxiety, severity, bipolar or schizophrenia. But then this COVID-19 has started many new fires. And it would be like how much close we got to it. Like, did we get directly affected? Was our loved one directly affected? Were we financially affected, socially affected? So think of it this way. You know how when you have been around burning fire, somebody would just inhale a lot of smoke and have injuries because of inhalation. Somebody will get first-degree burn, somebody will get second-degree burn, somebody will get third-degree burn. That's how I am categorizing that some people who already were depressed and anxious will feel worse. Some new people who were struggling with depression and anxiety but were not in treatment were coping somehow. This has been the last straw, and that they would start expressing depression and anxiety. But then there will be new cases of those who just experiencing this trauma of social isolation, financial disturbance, not being around your parents. Then comes the third category, which I think is being exposed to acute trauma. So people who have been exposed to COVID-19 and are recovering, they will also develop a lot of anxiety and depression because it's almost like a near-death experience. So they will develop depression and anxiety, but those just having experienced that trauma will have like a PTSD picture. So we will see an increase in numbers right now, but it's just this curve is just going to increase. And that's why I have been doing more of this outreach and mental health work, that each one of us has to be very cognizant of this growing numbers that UN is calling a pandemic after the pandemic, that after COVID-19 pandemic, we will have a big mental health crisis. So we all should be prepared and ready at that. And we have to be very cognizant on one hand of the needs that are going to come, but also what are our resources? How can we collect the resources and augment our impact. So with that, I think I will pass it on to Siti. Siti, Hassan, and I have been working around mental health through Muslim Mental Health Conference, and it has been a great alliance. And I've visited Malaysia, have really enjoyed the food, but the friendship. And we hope that this collaboration continues to work between Michigan State and University of Putri.
Alhamdulillah, thank you very much, Dr. Abbasi. Many thanks to Dr. Farha Abbasi from Michigan State University. Secondly, I'd like to introduce to the floor our second speaker, Dr. Siti Aishah Hassan from AMNA. Associate Professor Dr. Siti Aishah Hassan has become a lecturer in the Department of Counselor Education and Counseling Psychology, Faculty of Education Studies, Universiti Putra Malaysia, UPM, since 2006. She is actively involved in various research projects, especially those related to marital, couple, and family counseling. She also leads research on counseling supervision and post-traumatic stress disorder among flood victims. She has been consistently researching on practice of Islamic psycho-spiritual approaches, a unique approach for Muslim clients. Dr. Siti Aishah Hassan has been appointed by Michigan State University, MSU, in collaboration with International Muslim Mental Health Association, USA, and Association of Muslima, for Nurture and Advocacy, AMNA, to lead organizing International Muslim Mental Health Conference in Malaysia. In conjunction with the 10th Annual Muslim Mental Health Conference, IMMHC, in Washington, D.C., USA, she chaired an inaugural IMMHC 2008 at Universiti Putra Malaysia, UPM. She also has been invited in 2018 as a special guest speaker for presenting her innovative model of Maqasid Sharia Discernment Counseling, short form as MASDICTUM, at Oxford Family Counseling Institute. And in 2019, the Cambridge University as presenter in Global Muslim Mental Health Conference. Dr. Siti Aishah Hassan has won numerous international and local awards. She won 5 gold and 1 bronze award for research and innovation. She also won Excellence in Public Speaking from Indiana University, Bloomington, 1998. Dr. Siti, I give you the floor.
Thank you, Madam Chairman. Bismillahirrahmanirrahim. Thank you. Assalamualaikum, and a very good morning to Malaysian viewers, and a very good Ramadan night to American and all others viewers. As mentioned by Dr. Farha and Rismalati, my specializations is family counseling. So today I'll be talking the challenges of COVID-19 in the perspective of family systemic theory perspective. So since the COVID-19 outbreak pandemic, life has changed and will continue to change for most people around the globe. And systematic theory views individual as a complex system of interacting element with their environment. This is theory of von Bertalanffy. And family is considered as a secure base to protect members from outside danger and safe haven to promote health and mental well-being. However, to break the chain of COVID-19 and flatten the curve of pandemic, movement control order has been enforced. The mantra, stay home and stay safe, may not be applicable to everyone. Research indicates that there is an increasing rate of internal partner violence around the globe, and Malaysia is no exception. Why is it so? What are the factors that lead to IPV? I will explain IPV influencing factors from one, Islamic perspective, and two, from the Western and Islamic-based perspective. From Islamic perspective, how I see it, in the Quran, Surah Al-A'raf, verse 179, Lahum, a'udhu billahi minash shaitanir rajim, Lahum qulubun la yafqahun. They have heart, but they don't understand. In Islam, understanding is not at the cognitive level, rather at the heart, at the effective level. Despite they have degree, they have PhD, I'm sorry to say, even they have Sharia law or whatever, still they cannot understand. There are two main issues of why IPV happen among Muslims. Number one, they do not able, or they misunderstand, or rather fail to understand the concept of qawwam. In Al-Quran, Surah An-Nisa, verse 34, Ar-rijalu qawwamun 'ala an-nisa. The concept of qawwam. Qawwam means protector, not tormentor, who inflict mental and physical suffering to his family members. Number two, the very concept of khayrukum li ahliha. The best among the best of you is the one who treat his best wife. His wife best. So these two concepts, if Muslim can understand internally by heart that they need to protect man, their very role is to protect the woman, not to torment their family members. This internal partner violence can never happen. And if they understand their level of iman, their level of faith is being measured how good they are treating their wife, they will never ever think of to hurt even emotionally to their wife. So what are the Western perspective? Now, Western empirical perspective see this internal partner violence. First, social learning theory by Bandura, modeling. If the society see that internal partner violence is okay, we do not care, we do tolerate of the violence, then this will keep on increasing. Number two, theory by Bowen, intergenerational family theory, like father, like son. If you see your father beat your mother, most likely you will transmit this behavior to your family member. Number three is inequality of income of employment. A study in Oxford stated that 1% of increased unemployment among women, there is 3% increase of internal partner violence, intimate partner violence. And number 4 point, there are lots of points, but I would like to just highlight these 4 points. Number 4 is cohabitation. Research indicates that higher percentage of intimate partner violence are among women who stay together with another man, an intimate partner, without any legal marital relationships. So these are the 4 factors, according to research and Western perspective, why internal partner violence is happening. And we understand that during movement control order, these victims, they cannot run anywhere. They are trapped in their own home, supposed to be safe haven, but it become like a hell for them. So what are the solutions? What are the coping mechanisms of internal partner violence? Basically, women take 2 styles. They adopt 2 ways of coping with intimate partner violence. Number 1, the approach of coping mechanism is maintaining the status quo, perpetuating the cycle of intimate partner violence. And number 2, change and problem solution approach. So what are the things that women do there are men who are being abused, but the percentage is very small. So I would rather not to talk about how men being abused. I would rather focus on the majority of violence, domestic violence, when women are the victims, since I'm the woman as well. Number one, what women usually do is they keep silent. They thought that they're being passionate. They thought that they accept what God is something that is heavenly behavior of accepting what is given to them. And they make dua, and of course in Ramadan we encourage to make dua and wait for miracle. So these are the things. I'm not suggesting that don't make dua or don't be patient, but the point is that the misunderstanding of concept of patient and Allah is an issue here. Number two, what will keep on perpetuating of this IPV is that they take the placating communication pattern. When their partner become violent, they try to pacify by offering him nice, sweet talk words so that it will calm down. Or they offer good food or even sex to calm down their partner. Yes, it will reduce their partner anger for that time, but usually it will repeat the cycle over and over again. And another approach that how this woman taking coping with IPV is that they having humor communication pattern. This is to distract him so that it will reduce his tension and anxiety and anger so that he can become calm. Yes, it will have reduced at that moment, but it will keep on repeating over and over again. So what are the other coping mechanisms? The coping mechanism, that the more effective coping mechanism is to change and problem solution approach and stop IPV forever. Number one, if you are being beaten up, if you are being abused, run, seek help. Go to shelter home. In Malaysia, we have that. Okay. Number two, seek professional help seeking. You need to understand, you need to learn assertiveness. I am worth, I don't deserve to be beat up. There is a training you can join, you can be helped. And planning, number three, planning and take action for a better future. So these are the three approaches women can take to solve the problem and make a change in their life. With that, I would like to thank you for listening. Yes, Madam Chairman, you may take the floor again.
Thank you ever so much, Dr. Siti Aishah Hassan, for the enlightening IPV issue. Moving on, we shall now have a question and answer session for all our viewers. We have allocated quite a big chunk of the session. So Dr. Farha, Abbasi and Dr. Siti Aishah will entertain all your questions, inshallah. We will begin. We already have a couple of questions. We will begin with a question from the floor from Miss Diana. Is Miss Diana here?
Hello. Hello.
Yeah.
I think I'll just type. Okay, my question is for Dr. Aishah. Dr. Aishah. As a recovering patient myself, I just like to ask you your opinion on how what are your recommendation on what patients who suffering with mental health should do while dealing with family members who are not the understanding of their state, their mental state, with the movement control order and having to be at home more often. Like, what are your suggestions on what the patient should do on dealing with family members who aren't as understanding? Okay, that's all. Thank you.
Thank you very much, Diana. Over to you, Dr. Siti.
I think this question can be answered by Dr. Farha as well, because it's related to mental health. Would Dr. Farha would like to answer first?
So what I understood, there is multiple questions in there. First of all, somebody who is still already struggling with depression or anxiety and not getting the support from the family not understanding how it presents or impact or affects you. Second thing is, because of this enforced social isolation, you are kind of forced to be around these family members. So how do you balance that out? The important piece is, yes, it's very hard to deal with stigma, and especially if your family is not supportive, these can be very challenging times for you. So first, continuing your care. If you are taking medications or talking to a therapist, it is very important that you do not internalize what the family members are saying, and know that this is just that they don't have the knowledge or awareness. Unfortunately, with mental health, the biggest struggle becomes that it is not visible. So like if you had a fracture or if you were wearing band-aids, they can see it visually and understand you are in pain. But if you say, I'm in pain, and they see you are all healthy, then they would say, you are being slow, you are being lazy, you are not participating. So maybe this is not going to be the time to explain things to them, but for you to understand that this doesn't mean that your disease is in any way less or not real. So it is extremely important for you to continue your care and talk to therapists if you have, talk to friends that know about your health issues, talk to people like Siti, Aishah, find out other resources in the community, utilize every possible resource to get through this time. Once you get through this time, then you use that chance to explain to your family, educate your family, connect them to your therapist, or again, to other resources in the community. So I hope that you this is the moment to take ownership of your health, like you would be healthy, sleeping okay, exercising, keeping yourself healthy. This is the time to take care of your mental health. It's very important.
Mm-hmm.
Thank you, Dr. Farha, for helping answer this. I would like to add a little bit. So, talking from the perspective of a mental health survivor, we would want that the family members to understand what is going on. And I'm not sure whether the family members actually do involve during the therapy session. As a systemic perspective counselor, I would encourage very much the family members have to involve. Is the system a person is a subsystem of the family? One can never be totally good or improve or otherwise if the environment is not supportive. So most effective approach is to get involved. Family members become the co-therapists together with the therapist, whatever that you or clients are attending, seeking for help. So approaches of systemic family is rare in Malaysia, but yes, we do offer that. So when we have chance later on, I hope this movement control order will be lifted soon. Actually, we have been lifted. So attending together with family members during the therapy session, I think would help them, because we cannot explain to them. Only therapists, most likely the family members, can listen from and trying to understand from the words of the therapist. That will help much better, rather than you trying to explain to them, right?
And what we have been doing here in America is we realized early on that for our community, faith leaders are very important. The imams are very important. So we also have been using support like of the imams. When the imams talk about mental illnesses, talk about how it is already mentioned in Quran Sharif and how you can use Quran to help and heal, then, you know, it becomes more, people understand it more. So using all the resources from professional, mental health professional to faith leaders to other family members, friends who have been through this or who have more understanding. So you have to create that kind of network.
Thank you ever so much, Dr. Farha, and also Dr. Siti. And we do have a second question from the floor. We have Mr. Ashraf, who will be giving us our second question for today. Mr. Ashraf, over to you.
Hi. You hear me?
Yeah.
All right.
Yes.
So we got a question from the student at UPM. So the question is, how do panelists suggest to help cope the COVID-19 pandemic challenge with the new norms and restrictions so that we can keep our productive level high, optimum, and what makes us become resilient? What do we as students need to do, and what lecturers can do to help us? So that's the question.
Yeah. So one thing we always our patients, students, even, you know, right now COVID-19 is affecting a lot of health providers, people who are taking care of these patients, or firefighters or police force. Everybody is getting affected by this, right? So the one important strategy that we all can use is that focusing on what is good happening around us, what positive is happening around us, focusing on that and using cognitive reframing, which means instead of thinking like, oh my God, this is the end of the world, it will never end, I'll never go to college, I will never finish, I will have fun. Instead of focusing on that, say that, thank God I'm doing well, Alhamdulillah, I'm healthy, my family's healthy, and I'm choosing to do this right now to keep everyone safe. And even if you put it in religious concept, that saving a life is like saving a humanity. So just by this social distancing, just by staying home, you have saved so many lives. So focusing just on positive of things instead of the negative. And again, taking care of yourself, using exercise, sleep, healthy eating. I know it is hard because usually when we have traumas or pandemic, it's like you have earthquake or fire, but then it ends. This is kind of difficult, more difficult to handle because we are not seeing an end to it. So every day you are seeing grief and anxiety, but it is prolonging. So more so the reason that it is, this time is very important for you to take care of yourself. Focus on healthy habits, like if you enjoy listening to music, if you enjoy reading Quran, if you enjoy painting, if you enjoy taking small walks, like 15-minute walk, if you can't go for long walks in a Ramadan. Focusing on the ibadahs, focusing on the fact that your family is doing well. Thinking of that instead of, because, you know, as human beings, honestly, we think we have a control over future. We can only exist in today. Even our religion told us that, science tells us that. A lot of anxiety comes because we think we have to plan and control the future. Planning is good, but you do not have a control over the future. Anyhow, we never had this control. Just right now, we are feeling more of it because there is no predictability of tomorrow at this point. But knowing this, that you are capable, you are strong, you have been through past challenges, you have made it till today, and alhamdulillah, there is no reason why you wouldn't make it till tomorrow. Another thing is, you are not alone in this. This is the whole world is getting affected. We will all be living in a post-COVID world. None of us know how that's going to look like, right? But it is not just going to be you. It's going to be each one of us. So keeping that in mind, that it's not one person getting affected, everybody is getting affected. And then when there are so many people affected, then there is more strong community solutions that come out. So hopefully we all will get through this, and inshallah we will have good outcomes. So always staying.
Thank you, Dr.
Alhamdulillah,
Farha.
Dr. Siti. Would you like to add, Dr. Siti?
Yeah, sure. I will add on the perspective of lecturer, how we can help students. Number one, I think we have to be very flexible in giving assignment to students. Whatever that we used to give, we have to change. Life is about change. Everybody is changing. Life is changing. Nothing is static. So whatever that we give from day one, when we give the course requirement, we have to adapt and change. There is impossible things can be conducted as it is. So we have to be flexible, not only in terms of changing the assignment that is more suitable to suit the needs of the students under these circumstances. We also need to be flexible in terms of extending the time. Instead of like we are giving for internship, instead of 14 weeks, we're trying to extend into 16 weeks so that you have more time, students have more time to complete the hours, whatever that they need to complete. So I think this is another approach at how lecturer we are thinking of how to help students to reduce the anxiety level so that you can students can graduate successfully despite the challenges. And we're trying to, doesn't mean that when we become flexible we are reducing some kind of quality. No, we don't have intention to reduce the quality, rather we're trying to be flexible so that wherever you need to learn, you're still learning whatever that you ought to learn, whatever competency you ought to have. We intend to make sure that you have that, but with a more flexible assignment and more flexible time so that you can complete the task that you need to complete. This is how I view how lecturer can help students to reduce the student anxiety level. Thank you.
Thank you very much for both Dr. Farha and Dr. Siti. Shall we now see if there is any written question by viewers? I think we do have quite a sum, yes. And I will give to you my friend Puan Sapida. She'll be reading the written question for both of our panelists. Puan Sapida,
okay.
Over to you.
Okay, sure. Thank you. Thanks a lot, Rismalati. There are a few questions that have been posed in the chat. I will read starting from, okay, even at the beginning. Someone was asking, Tengku Fadilah Tengku Kamaldin was asking, the panelists, could you share a bit on how male partners abuse happened?
Yeah, I can add to it a little bit and then we can go. So you are talking about how male become the victim. So the thing is that be it male or female, all of us are capable of acting out in a violent way. But one thing we have to differentiate is someone reacting in the moment of acute stress and somebody who is habitual of perpetuating this violence. So the thing is that whenever we are not cognizant of our own coping skills, when we get irritable and angry, then we kind of lash out, we react. We also, people who have suffered their own traumas, like Dr. Aishah, Siti Aishah was saying, that have seen their fathers beating their mom, or has seen violence. So the women who have seen their mothers being abused, they can become very aggressive in anger and can be physically abusive toward men. Same way, men who have been beaten up or have been abused can then do this towards their wife and children. I think what happens is that when you have been violated, have been traumatized, are angry, frustrated right now, maybe unemployed, or maybe socially isolated from your usual things. The anxiety, the anger, it's just bubbling up. It's like a pressure cooker and it bursts, right? And it always goes towards the weak in the family. It could be children, it could be wife, it could be husband, or in some cases in America, we see violence towards pets also happen. The important thing is that to understand that you cannot internalize it. The victim cannot internalize it and think that they are responsible for this happening. There is nothing you are doing or not doing. I really like the point that we try to appease the abuser by doing like a short term solution, like talking nicely or feeding them or kind of making sure they're not get angry. That doesn't help because you are not doing anything. It's an internal vicious cycle they are going through. They go up, burst, and they go down and become really nice. Then they will again become angry, burst. So it's a pattern they follow. So you cannot internalize it or be responsible for it. What we are hoping is that you kind of become responsible for getting away from this situation, which is like accessing care or going to the shelter. And I saw somebody was asking, where are these shelters? So maybe you can talk about that.
Okay. I would like to reiterate a question Dr. Tengku asking, how can the male become the victim instead of the abuser? There is about 1% of male being the victim instead of the abuser. The percentage is not high, but there exists. How can they become? Because the wife is very strong and loud, and they just beaten up their husband. As simple as that. I don't want to talk another side of violence whereby they can have a sexual violence and they can manipulate men through sex. Men can become victim out of that. That I think deserve another webinar to discuss on that issue, I think. But yeah, that's how men can also be beaten up by wife. It's not huge, about 1% of the domestic abuse percentage. And the question where to find in Malaysia, we have Talian Kasih 1559. You can call up. That number is always announced in the TV, and you can open up the Ministry of Women and Family Development. There's a number you can contact, and you can report, can explain your situation. They will take up your plight, and they will take a further action. And there are shelter homes, numbers of shelter homes by the government and also by NGO. There's a link when the government is full, the NGO can support you to help you to seek help and to run away from keep on being abused by this tormentor. Instead of protector as a man, they are meant to be protector, but they are tormentor. So you can run and you seek help, and you need to plan for your future. So when you want to run, what actually you want to do, you have to have that in mind. But of course, while you are in anxiety, anxious, you cannot do planning. But when you go to the shelter home, you will have time, sit all by yourself, and then you will be relaxed, and there is plan coming up where you want to take action of your future, how you do not have to rely the love of this abusive partner. In Islam, we believe God is Ar-Rahman, Ar-Rahim. He is so merciful. He is full of love. We do not need the love of the abuser. All right. We believe that if we believe in God, if we believe God is so merciful, He will send down one good man for you. If you really need a man. If you don't, then God will not send you. But if you really need a man, then I believe He will send you. It's a miracle. Yes, it is a miracle. Sometimes it's just like He coming down from the heaven for you. It's a miracle. It can happen. But take action. Run away. Do not keep yourself being abused. That is step number one you have to do to help yourself. Run away.
Okay, thank you, Dr. Siti. There's another question from Anissa Majid. This is for Dr. Farha. Dr. Farha, as far as I'm concerned, you have been training imams in US to be the responder or psychology first aid. My question, what is the first thing imams should do in pandemic situation besides asking people to keep praying, which is of course good?
So it's very interesting. We did a lot of webinars along with the imams. So we are seeing this domestic violence cases have increased world over. Crisis lines are like the call volume has almost tripled. So we were very concerned about the violence increasing in our own community. So we partnered with imams to talk about, like in light of Islam, Sharia, Prophet's example, and then the professional combining with imam, I think there is a very strong, powerful message that comes out. So we did webinars on that, but we also did webinar on how, because the Ramadan is so different this time, you are socially isolated, masjids are closed. So in America, Islamic centers are very important. They become our identity, cultural identity. So in Ramadan, whole families used to go pray, open fast, and do tarawih. All that is stopped now. So how to replace that, how still to stay positive. There is a lot of virtual khataras happening. There's a lot of virtual bayan that is imams are doing, and they vary from tafsir to your everyday coping skills to talk about domestic violence to how to continue to focus on the positive of this Ramadan, not to lose the spirit of Ramadan because of the COVID-19, how to make it more meaningful. So it has been really great that we had established this relationship with imams, and this is happening all over America. It's amazing how many imams and mental health providers are now partnering to do community work. Also, of course, other part of it is we have been reaching out to imams also, because this COVID-19, if we talk about first responders, then our faith leaders become first responders too. Making sure they are taking care of themselves, they are being healthy, their needs are being met. How can we help share their responsibility? So it has been a very beneficial relationship.
Okay, thank you, Dr. Farha. I would like to take one question from our WhatsApp. It says, this is from Tengku Noraisha. It says, family dynamics significantly impact health in both positive and negative ways. Having a close-knit and supportive family provides emotional support, economic well-being, and increases overall health. When family life is characterized by stress and conflict, the health of family members tends to be negatively affected. So how can families cope with the stresses due to COVID-19 pandemic?
You want to go, Farha? Go first.
So the thing is, in our community especially, I see that we use a lot of avoidance. So even if there were conflicts happening in the family, because husband could go to the job, wife could go to the job, kids were in school. So everybody had that break, you know, you could avoid and just go and just come together for a short time period. Unfortunately, with COVID-19, already the stressors are high. So schools are closed. Kids are have to be like homeschooled. The kids don't have any space to go out that much. So they have a lot of energy. They are acting out more. Then comes the husband, wife. If there was a conflict, they can't really run away from each other. So we saw some studies came out of China, actually, that the divorce rates increased in China after domestic violence. The divorce rates also increased because people were forced to deal with their conflicts. I think as a mental health provider, I always say, whatever the conflict in your life, you should make it visible. Unless you don't make things visible, you would not understand that it's a problem, you will not seek help. Then the important piece is, once you know there is a conflict, there is a difference of opinion or anger or resentment, then it takes two healthy people to sit down and have a conversation. If one of you is eager to work it out and other is still being negative, it would be hard for you to just deal it on your own. That's why it becomes important to bring therapist or family therapist in this situation. Now, unfortunately, you don't have that luxury, but you do have, at least in America, there is so much virtual therapy happening, virtual telepsychiatry happening. So we are taking care of our patients more than ever because of telepsychiatry. Actually, you have the access right in your home. You don't have to leave your home. So I'm sure there are resources in Malaysia, and maybe you can talk about that, but calling those crisis lines, but keeping a safe environment is important. Even within a house, having those boundaries, maybe just identifying one room, one space, kind of having those signals that this is getting in a dangerous zone. We should not. Remember, even as for a child, we say, don't teach a child when they are angry. Always you can teach a child better when they are playing. So when a child is happy and relaxed, you can teach them much more than out of anger or screaming. Same goes with couples, that a lot can be achieved when you are relaxing, when you are enjoying something together, maybe opening a fast, a meal, watching something on the TV, playing with the kids. When the environment is relaxed, you will have more impact. As soon as the things start to escalate, it is important to disengage. Extremely important to disengage. Have identified areas, clear boundaries that you're getting irritable. I'm going to sit in my room for a few minutes and will not come out. Please don't disturb me. Same way the husband should, the spouse, husband, wife, should have that luxury, and you should understand. Sometimes what happens, we get so anxious, we are trying to fix that problem right there and then. Remember, the problem didn't start today, and problem will not end today. Only thing you can do right now is cope with it so that there is not bad, dire consequences happening right now. And again, taking care of yourself. If there are things that make you anxious, then there are things that will make you relaxed and happy. So seek those out, take care of your needs, and take care of other people's needs. If you need the quiet, then please be accommodating to others as well.
Thank you, Dr.
Thank you,
Farha.
Dr. Farha.
I think your answer is lengthy enough. Then I think we can take up another question, Sab. I think you have said what I want to say.
Okay. This is on family matters. Somebody was asking, what are the differences in terms of Muslim family reactions in the US compared to the one in Malaysia?
I can tell you one thing that sometimes what I see, and I can talk more in terms of what the difference I see from families in Pakistan versus Pakistani families in America. I think what happens when we are a minority in a country like America, we tend to be more conservative, more strict sometimes. And you would see back in our countries, there would be sometimes more flexibility around issues because everybody is doing the same thing, right? Everybody is dressing certain way, is going to school certain way. But just think of Ramadan in America, how hard it is to navigate it when you are the one fasting, but your kids are fasting, but when they go to school, there's food, there is sports, there is expectations from them. So they have a lot of pressure on them. And I feel like sometimes the kids feel like they have to live two lives, one outside the home and one inside the home. So I constantly talk about finding that middle ground. Like we are in a different culture. We will have different kind of, our kids are, even if we teach them religion, we teach them culture, most of the time they are seeing their country is different. Our country might be Pakistan, their country is America. So they are mostly seeing the politics, the peer pressure, or just the thinking is different. Like sometimes with my own daughters, I have to navigate. They like when they sometimes feel that our culture is more patriarchal, put men above the woman. It is not, it is very gender equality in America. So it is hard for the daughters to understand why we have to do certain things culturally. So that's a lot of navigation. And then finding that middle ground is important, where you have to adapt the host culture also, and you have to bring your home values, and you find that happy middle ground for your kids. Because I see that sometimes parents here in America become more strict than they are back home in Pakistan or in Malaysia. You want to add something?
No, thank you. I think the time is almost up, Madam Chairman.
Thank you very much, both Dr. Siti Aishah and Dr. Farha Abbasi, for a very enlightening and very informative question and answer session. I'm sorry, we do have a little bit more, but we can't. We will probably do a written or somehow answer the questions later. Since we, in the interest of time, we have to stop it now for the question and answer. Before we end, I have a little invitation for all of you. You all are invited for the following event. We have AMNA Webinar 2.0. The title is Sustenance of the Soul, Islamic Cognitive Behavior Therapy in the 9th Century of Al-Balkhi, translated by Professor Dr. Malik Badri himself. It is on Saturday 23rd, 2020, 3 p.m. Malaysia time, Kuala Lumpur, and at the same time at 10 to 12 p.m. Turkey time, Istanbul. Our moderator for that day will be our own Associate Professor Dr. Siti Aishah Hassan from Universiti Putri, Malaysia. And the panelists
Can we call in from States?
Sure.
Sure.
Yes. You are all invited.
Everyone's invited. Yeah. Yeah. He will be there, Professor Dr. Malik Badri from Istanbul Zaim University.
But it'll be 3 a.m. for USA.
Yeah, a bit of Qiyamul, inshallah. And also you'll be seen with former Professor Dr. Othman Muhammad from UPM and Professor Dr. Stephen Cross, UPM. Those are the panelists for the next webinar 2.0. Thank you very much. And before we log off, I would like to give a shout out today to all teachers in Malaysia, because today is Happy Teachers Day to all teachers across the country. And a very special thanks to every one of you that spends your lovely morning time and evening time to be with us in this very
I would also like to thank Mary Firdausi for her staying after hours to help us put this together. Thank you.
Thank you. Thank you very much. And we will end this webinar today, inshallah, with a very special video. And this video will be saying goodbye to all of you. Mary, over to you, rolling the video. Thank you very much. Assalamu alaikum.
Wa alaikum assalam.